Hello students, today we will learn a very interesting topic, that is nerve supply to whole upper limb through brachial plexus. So here is a picture showing beautiful brachial plexus. So before beginning we will understand how they get origin. Plexus means network, brachium means arm. So these plexus are meant to supply the upper limb, so they are called as brachial plexus. They are the network of nerves which are formed from the anterior primary rami. So I am drawing a cut section of spinal cord where we can see the central head-shaped gray matter. So each has got the posterior root or the dorsal root which relay here. Here is the dorsal root ganglion and now this is the ventral root. The dorsal root and ventral root, they join to form the spinal nerve. So here also the dorsal and ventral roots, they join to form the spinal nerve. And each spinal nerve, as soon as it comes out from the intervertebral foramen, it divides again into anterior division and posterior division. So this is the posterior ramus. This is the anterior ramus, which is called as anterior or the posterior roots. These anterior roots will give rise to the brachial plexus. So now we know that the spinal nerve, the typical spinal nerve, it divides into ventral primary rami and dorsal primary rami. Ventral are also called as anterior primary rami. So the C5 to C8 and the thoracic nerve gives rise to brachial plexus. We can divide the brachial plexus into roots. So it consists of roots, then trunks. Roots join to form trunks. Trunks divide to form divisions. And finally, the divisions gives rise to cords. And cords divides into branches. So these are the components of brachial plexus. The brachial plexus, before entering into the upper limb, they are crossed by the clavicle. So because of its relation with the clavicle, brachial plexus you can divide into three parts: supraclavicular part, which is above to the clavicle; retroclavicular part, where the divisions are related, are retroclavicular part, which are present behind the clavicle; and infraclavicular part. So these are the three parts of brachial plexus. So starting with the supraclavicular part contains roots. The rami enter the posterior triangle of the neck between the scalenus anterior and scalenus medius muscle. So the roots will enter, that is the C5, C6, C7, C8 and T1 ventral roots. They enter the posterior triangle between two muscles called as scalenus anterior and the other is the scalenus medius. Sometimes what happens, the C4, that is above C5, C4 may also contribute in the formation of brachial plexus. If C4 gives a larger contribution, then the T1, the last root, may be absent in such cases. Then it is called as prefixed plexus. In postfixed plexus, T2, that is below T1, T2 is present. So if T2 contributes, gives a major contribution to the brachial plexus, in such cases the C5 and C4 will be reduced or absent. Such cases it is called as postfixed plexus. So now we know about prefixed and postfixed plexus. So the roots join to form three trunks which cross anterior to the first rib, and there are three trunks: upper trunk, middle trunk and the lower trunk. So here are the trunks. This is upper trunk, middle trunk and this is the lower trunk. Upper trunk, we can see C5, C6 joins to form upper trunk. C5, C6 joins to form upper trunk. C7, that is the middle trunk, continues by the C7. So C7 root continues as the middle trunk. Whereas the lower trunk, it is formed by joining of C8, T1. C8, T1, they join to form lower trunk. So these are the three parts, and all these things means roots, trunks will be the supraclavicular part. So now we are done with the supraclavicular. Next about the retroclavicular part, and retroclavicular part is formed by the divisions. So each trunk divides to form one anterior division and posterior division, which are also called as ventral and dorsal division. So each trunk divides to form two divisions, and divisions, the part of divisions lies behind the clavicle, so it is called retroclavicular part. So divisions are two from each trunk. Here is the upper trunk, this is the anterior or ventral division, and here is the posterior division. Middle trunk also divides into anterior and posterior, and the lower trunk again divides into anterior division and posterior division. So these are the divisions which are the retroclavicular part. Now these divisions joins to form chords. So chords are the confluence of divisions. So there are three chords: lateral, medial and posterior chord. These chords are named based upon their relationship with the second part of axillary artery. Means the lateral chord is present lateral to the axillary artery, medial chord is medial to the axillary artery, and posterior chord lies posterior to the axillary artery. First we will see the lateral chord. Lateral chord is formed by the union of ventral divisions of upper and middle trunks. So here is the ventral division of upper, and this is the ventral division of the middle. So we can see this is the upper trunk, this is the middle trunk. So ventral division of upper and middle, they join to form a chord. This chord is the lateral chord. Medial chord. Medial chord is formed by the ventral division of the lower trunk. So this is the ventral division of the lower trunk. So this is the medial chord. And next about the posterior chord. Posterior chord is formed by the union of posterior divisions of all the trunks. So you can see the posterior divisions. So this is the posterior division of first, posterior division of second, that is the middle trunk, posterior division of lower trunk. All joins to form here one chord. So this chord is the posterior chord. So these are the three chords of brachial plexus. Let's see the branches from each chord. So the branch from the posterior divisions, that is the posterior chord of brachial plexus, posterior chord innervates extensor musculature, that is the posterior compartment, arm and forearm. So the anterior divisions and the lateral and the medial chord innervates the flexor musculature. Let's see the branches from the roots. The roots gives off two branches mainly. One is called as nerve to serratus anterior, which is also called as long thoracic nerve of Bell. So the roots of C5, here we can see, draw a line over it. The root of C5 we can see here, and root of C6 and root of C7, all these are joining here, coming down. This nerve, the one which is getting joined here, this nerve is the long thoracic nerve, which is also called as nerve of Bell or nerve to serratus anterior. Serratus anterior is a boxer's muscle, it is also called. So it supplies all the 8 digitations of serratus anterior muscle. So long thoracic nerve, it is given off in the neck, it enters the axilla and descends on the external surface of the serratus anterior muscle and supplies it. Next about nerve to rhomboids, which are also called dorsal scapular nerve. So from the C5, root, this nerve to rhomboids will arise, which supply rhomboidus major, rhomboid minor and levator scapulae. All three muscles are supplied by nerve to rhomboids. So I'll just show this is the C5. So once from C5 the nerve which is arising here, showing in the blue color. This one is so nerve to rhomboid is also called as dorsal scapular nerve. Supply three muscles: rhomboid major, rhomboid minor and levator scapulae. And this nerve runs along with the dorsal scapular artery on the deep surface of rhomboid muscles along the medial border of the scapula. These are the two main branches. So next about the branch to phrenic. Phrenic nerve is the nerve which supplies the diaphragm and it has the root value of C3, C4, C5. So the C5 root which arises from here, this is branch to the phrenic nerve. And branch to longus cola and scalene muscles, they arise directly from the roots of C5, C6, C7. So you can see all these small twigs which are arising from the C5, C6, C7, C8 and T1. All the roots will give rise to branches to longus cola and scalene muscles. Next we shall see the branches of each trunk. The upper trunk gives rise to two branches. Suprascapular nerve. This one is the suprascapular nerve. I am writing N for nerve. The suprascapular nerve passes deep to the trapezius and joins the suprascapular artery. So it runs along with the suprascapular artery in its course towards the shoulder and passes through the suprascapular notch, which we know it is present along the superior border of the scapula, and after entering through the notch under the superior transverse scapular ligament, it supplies supraspinatus and infraspinatus muscle. So suprascapular nerve supplies supraspinatus, infraspinatus muscle. The root value, now we know it is from the upper trunk, and upper trunk is formed from C5, C6. So the root value of suprascapular is C5, C6. Next is nerve to subclavius. So this nerve, what we are seeing from the lower part of the trunk, it is arising. This is nerve to subclavius. So as the name says, it innervates the subclavius muscle. It too descends in front of the plexus and behind the clavicle. It runs behind the clavicle to innervate the subclavius muscle which is present below the clavicle. And let's see the branches of cords. So we know there are three cords. So the first is the branches of lateral cord. So the lateral cord, the root value which are arising from the lateral cord are C5, C6, C7. And to remember the branches, we can remember the abbreviation as LML. L for lateral pectoral nerve. This is lateral pectoral nerve. I am writing L for lateral pectoral nerve. And M is the musculocutaneous nerve. This is musculocutaneous nerve. And again L is the lateral root of median. So this is the lateral root of median which joins with the medial root of the medial cord to form the median nerve. So the lateral pectorals, first we will do with the lateral pectoral. It supplies majorly to pectoralis major muscle, but sometimes it may also supply to the pectoralis minor muscle also, and via the branch to the medial pectoral nerve. So via the branch to the medial pectoral nerve, it may also supplies to pectoralis minor muscle. Next about the musculocutaneous nerve. As the name suggests, it supplies muscles as well as the skin. So it is a nerve of the anterior compartment. So it supplies all the muscles in the anterior compartment of arm, that is coracobrachialis, biceps brachii and brachialis. And it gives a cutaneous branch which is called lateral cutaneous branch of forearm that supplies the skin of the lateral aspect of forearm. Next about the lateral root of median. So this is the lateral root of median which joins with the medial root of median. I am drawing over it. to form a nerve called as median nerve. So the median nerve, they both join to form median nerve, which is the nerve of forearm. So anterior compartment of forearm, most of the muscles are supplied by the median nerve. Let's see the branches of the medial cord of brachial plexus. So for branches from the lateral cord, we remembered abbreviation LML. And branches from the medial cord of brachial plexus, you can remember as MUM4. U stands for ulnar nerve. M4 means there are 4 M's. So we'll start with the medial pectoral nerve. So the medial pectoral nerve, which is a branch of the medial cord of brachial plexus, it supplies pectoralis minor and sternocostal part of pectoralis major. So here it is. This is the medial pectoral nerve. You can see it is communicating with the lateral pectoral nerve. This is the medial pectoral nerve, supplying pectoralis minor and also partly pectoralis major. Medial cutaneous nerve of arm. It innervates the skin on the medial side of arm. Then medial cutaneous nerve of forearm. It is having the root value of C8T1 like other nerves. So all the medial cord, remember C8T1 root value, and lateral cord C5, C6, C7. So medial cutaneous nerve of forearm supplies the skin on the medial side of forearm. Next, medial root of median. We already saw how the median nerve had formed, where the lateral root and medial root, they joins to form median nerve. Lastly, the ulnar nerve. This is ulnar nerve. So the ulnar nerve, the root value of ulnar is not only C8T1, even the C7 also contributes in the formation of ulnar nerve. Flexor carpi ulnaris and ulnar half of the flexor digitorum profundus in the forearm and most of the intrinsic muscles of hand and skin of the hand and medial side of the fourth digit. All these structures are supplied by the ulnar nerve. So ulnar nerve is the nerve of hand because it supplies most of the intrinsic muscles in the hand. So and also it gives a cutaneous supply to medial 1.5 fingers on the palmar surface. Let's see the branches of posterior cord of brachial plexus. So to remember the branches, we can remember the abbreviation as stars. I am writing here STARS, stars. And the root value for the posterior cord of brachial plexus is C5, C6. And some nerves are C8, T1, everything, because all the posterior divisions joins to form the posterior cord of brachial plexus. So here is the posterior cord of brachial plexus, which gives of several branches. Let's talk about one by one. The first branch is the upper subscapular nerve. As name suggests, it supplies upper part of subscapularis and the root value is C5, C6. L stands for lower subscapular. So lower subscapular, again the root value is C5, C6. It innervates the inferior portion of subscapularis muscle and also teres major muscle. So you can remember SS, 2 stars. In stars we are written first S and last S, which are nothing but upper subscapular and lower subscapular nerve. Then nerve to latissimus dorsi, which is also called as thoracodorsal nerve. So T is here, thoracodorsal nerve, which is nothing but nerve to latissimus dorsi, and the root value is C6, C7 and C8, and it innervates latissimus dorsi muscle. Next is the axillary nerve. Axillary nerve C5, C7. So A is for axillary. So the axillary nerve, the root value is C5, C6, innervates the shoulder joint, teres minor and mainly deltoid muscle. And skin on the superolateral aspect of arm over the inferior part of deltoid, where we say it as regimental badge, where the military people wear a regimental badge. So that part of the skin, the sensory supply is by axillary nerve. Lastly, the radial nerve. The radial nerve, the root value is C5 to T1. It innervates all the muscles on the posterior compartment of arm and forearm, and that is also it forms cutaneous supply to posterior side of the skin of the forearm, and inferolaterally posterior forearm and dorsum of the hand and lateral 2.5 digits. All this cutaneous supply is by radial nerve. Okay, let's talk about applied aspect of brachial plexus. The first condition here is the Erb's palsy. So the site of injury is upper trunk of brachial plexus. I'll show here. So this is the upper trunk of brachial plexus. So this is the site of injury for Erb's palsy. So we can see 6 nerves joined at the Erb's point, where the C5, C6 are joining to form upper trunk, and we can see suprascapular nerve to subclavius coming from here, and upper trunk further divides into 2 divisions, anterior and posterior divisions. So totally 6 nerves are meeting. I'll repeat again, C5, C6, 2 nerves, anterior and posterior division, 2 nerves, so totally 4, and next is the suprascapular nerve, and the other is nerve to subclavius. So all these nerves will get affected if there is any damage to the upper trunk of brachial plexus. And cause of this injury is during birth. It can occur due to undue separation of head from the shoulder during parturition or during birth, or fall from on the shoulder or during anesthesia. So these are the causes of the injury, and the roots affected in this injury are C5 and C6, where they join to form upper trunk, and muscles paralyzed mainly to the deltoid because the root value is C5, C6, brachialis muscle, that is the anterior compartment, because musculocutaneous nerve is also affected. So brachialis and biceps brachia of anterior compartment, partly supraspinatus, infraspinatus and supinator muscle. So these are the muscles which get paralyzed in Erb's palsy. So the deformity due to Erb's palsy is policeman's tip hand. Policeman tip hand, because they hold the gun by keeping their hand hands on each side, adducted and medially rotated. That is the reason it is called policeman tip hand. Let's talk about its deformity. So deformity at the level of arm. So at the arm, the upper limb is hanging on the side. So hangs aside and it is adducted towards the body, and it is medially rotated. So this is the position of arm. And elbow, you observe the elbow. Elbow is extended. And then forearm, see the forearm, it is pronated. And wrist and fingers, observe the wrist and fingers, they are partially flexed, means slightly flexed. So these are the deformity at each level, forming the whole deformity is called as policeman's tip hand or waiter's tip hand. The next condition associated with the brachial plexus is 𝐒𝐿M-𝐬𝐫𝐢𝐻 paralysis. So the site of injury is lower trunk of brachial plexus. So first we will see the lower trunk of brachial plexus. So this is the lower trunk of brachial plexus which gets affected in 𝐒𝐿M-𝐬𝐫𝐢𝐻 paralysis. So we can see the lower trunk, it is formed from C8 T1 roots, and the roots affected here are C8 and T1. The cause of injury of 𝐒𝐿M-𝐬𝐫𝐢𝐻 paralysis is it is undue abduction of the arm. So the lower part of brachial plexus, so it can occur during birth, that is during parturition, or it can occur due to clutching of something by hand after fall from a height. So here the person is clutching his hand after fall from a height, or due to the undue separation of the lower part of brachial plexus due to pulling out during parturition or during birth by pulling out by the hand. So the muscles paralyzed are intrinsic muscles of hand, ulnar flexus of wrist and fingers. So what we see, the deformity is like a claw hand, which is called as ulnar claw hand, or you can say partial claw hand. And in claw hand there will be hyperextension of metacarpophalangeal joints and flexion of interphalangeal joints. So this is how the claw hand looks. And along with the claw hand, the person also have the associated symptoms of Horner's syndrome because of the involvement of sympathetic plexus along with the lower trunk. So the Horner's syndrome, the symptoms are ptosis, drooping of the upper eyelid is called ptosis, miosis and anhidrosis, enophthalmos and loss of ciliospinal reflex. So these are the symptoms of Horner's syndrome, which is also associated with Kształt's paralysis. So next condition is injury to the nerve to serratus anterior, which is also called as nerve of Bell or long thoracic nerve. And injury to this nerve, it occurs due to carrying heavy weight on the shoulder and sudden pressure of the shoulder from above. So resulting winging of the scapula. So the medial border of the scapula becomes more prominent when a person is asked to push against the wall. The medial border of the scapula becomes more prominent. Condition is called as winging of scapula. And disability, loss of pushing and punching movements. And this muscle is a boxer's muscle. Serratus anterior is a boxer's muscle. So pushing and punching movements are lost. And loss of overhead abduction. The person won't be able to do above 90 degrees because serratus anterior rotates the scapula along with the head of the humerus in scapulohumeral rhythm. So that is also affected, leading to loss of overhead abduction. Arterial supply of brachial plexus is by the branches of subclavian artery and vertebral arteries. So important branches which you have to learn in detail are radial nerve, ulnar nerve. Radial nerve is the nerve of posterior compartment of arm. It is a branch of posterior cord of brachial plexus and supplies posterior or the extensor compartment of the upper limb. It is the largest branch of brachial plexus. So here is the radial nerve from the posterior cord. This is the radial nerve. I am writing R here. The next important branch is the ulnar nerve. Ulnar nerve is the branch of medial cord of brachial plexus and runs on the ulnar side, that is the medial side of the upper limb along with the medial side of forearm, and it is supplies most of the intrinsic muscles in the hand. Next, about the median nerve. This is also very important nerve. It runs in the midline. Median means in the median plane, in the center of the upper limb. So it runs in the midline of the upper limb and has the contributions from both medial and the lateral cord of brachial plexus as medial root and lateral root. Both roots joins to form median nerve. So this completes the brachial plexus along with its applied aspect and some important points. I hope you understood this topic. Thank you.